Dr. Sherry Yafai has been a cannabis and emergency medicine physician at Providence St. John's Medical Center since 2009. Dr. Yafai started her medical career at University California San Diego Medical School, graduating in 2005, and UCSD Emergency Medicine residency in 2009. In 2017, after recreational marijuana laws had passed in California, Dr. Yafai opened her private cannabis clinic, the Relief Institute, where she sees patients primarily referred by physicians for cannabis education and treatment. She is the co-vice president of the Society of Cannabis Clinicians, a member of UCLA Cannabis Initiative, and a distinguished speaker at UCSD's Center for Medical Cannabis Research, Pacific Neuroscience Institute, and multiple other medical programs. In 2018, she was accepted as an adjunct associate professor at John Wayne Cancer Institute, working with cannabis and cancer research. Ladies and gentlemen, please welcome Dr. Sherry Yafai.
Hi, everyone. Thank you so much for having me here today. I'm just going to share my screen with all of you, and we're going to get this discussion moving and shaking. All right. All right, everybody see my screen? Do we have that all up for everyone? Okay, so here we are today. Thank you so much for joining us. Today, we're going to be talking about 50 Shades of Cancer. Understanding cannabis during treatment and beyond. I'm going to give you just a little bit of an update on me. Thank you for the lovely introduction here this morning. As it's already been mentioned, my background was in medicine, I'm an ER doctor by training. So if you come to your local St. John's emergency department here in sunny Los Angeles, you'll sometimes see me there helping you out and not talking much, if any at all, about cannabis. In 2017, I did change pathways a bit and started working with cannabis, and found the more I worked with patients with cannabis, the more help I found I was giving them, as opposed to prescribing opiates and painkillers out of the emergency department. So I do have quite a bit of experience in this field now over the last 4 years. It's hard to believe it's been 4 years, but over the last 4 years, I have directed a group for rehabilitation called High Sobriety. I work in research at John Wayne Cancer Institute. I'm the co-vice president for an international program now for clinical information and education. I write a monthly column for Emergency Medicine News designed solely to educate our emergency physicians across the nation. And as you can see here, I do quite a number of other speaking engagements and advisory roles. I'm not gonna dwell on that. We're gonna move forward here. So a couple quick disclosures. I do sit on the board of the Relief Institute. I'm the founder and director, co-vice president of the Society of Cannabis Clinicians. I have been a paid educational speaker for Medical Services for People Science, a new organization and company coming out. All right, so as of 2020, we now have legalized and recreational use of marijuana or cannabis use. And the important part I want you to see here on this map is that out of the entire United States, we're seeing about 11 states prior to this past Tuesday, and 30 that were recreationally legal, and 33 states of which were medically legal. And now, as of this past week, I'm happy to announce that we have 4 more states that are recreationally legalizing cannabis use, and 2 more that have medically legalized. As you can tell, this is an overwhelming number of states that have some type of either medical or recreational rules on the books to allow for cannabis use for individuals. This is really important as we talk about kind of legality and what we think is right and where the medicine and understanding is of all of this. Okay, so most people, their first question when I ask them, have you ever used any cannabis products, is no, I haven't used anything. But then when we get into discussions, We find, yes, patients have used CBD, they've used THC, they've used other cannabinoids, and they aren't really even aware of what these different discussions are. So hemp, weed, marijuana, pot, dope, all of these things are all the same name for cannabis. So this is really when we're talking about cannabis, we're talking about all of these different parts and aspects and all the different things that go into it. And as you can see here, this is in the early 1900s. We used to have here in the United States different types of cannabis use that was legal at the time, and we had it in our medication. So this was a cough syrup that we had, as you can see here, cannabis as well as chloroform, morphine, and alcohol in it. So what is hemp? What is cannabis? You know, are these two things the same thing? They're not. They are very similar. They fall under the same umbrella. Cannabis is the overarching umbrella behind all of these different names. It's the plant. It is not the specific entities or chemical. So when we look at these two items on the screen, oftentimes I'll do a question and answer here. The part on the right, the plant on the right, is the curly-haired parsley, and the part on the left is the flat-leaf parsley. And you can see that, you know, both things have the name parsley, but both have different flavors and textures and usages for it. So we really want to make sure that we understand what the usages are because of what the chemical components are in these two things. So cannabis, you know, the umbrella term here for the whole plant species, is comprised of both THC and CBD, the specific chemicals, as well as over 400 other chemicals. So CBD, or cannabidiol, is going to be the non-intoxicating part of the plant. It is the chemical that is still active in the brain and active in most parts of our body, but does not intoxicate people. And that's the most dominant part of hemp. On the other hand, delta-9 tetrahydrocannabidiol, or THC, is the part that's most well known for its intoxicating activity. And this is something that we want to kind of modulate a little bit in our own minds, that it doesn't only intoxicate. It also has really great functionality in terms of pain management, nausea management, and sleep management. Now, there's over 400 other chemicals in this plant. And what's important to note about this is that we're starting to find a lot of new data, a lot of new information, a lot of new research about all of these different chemical components. So for example, I call it the alphabet soup of cannabis, but there's THCA, CBDA, THCV, CBN, CBG, and CBV that we're starting to see these types of research on. And so when people talk about whole plant or full spectrum, one of the things they're referring to is the inclusion of these other chemicals, also referred to as the minor cannabinoids. On the other hand, there's other chemical components in this plant called terpenes, which usually are what gives the plant its flavor, its smell, its scent, its kind of specifics. So now that we know these different chemical components to the plant, and I think a lot of people are starting to hear those things coming out more frequently, we can talk more specifically about how we want to use it. Only if you want to, right? Do you want to smoke it? You don't have to. This is purely an optional basis because you can use it in a lot of different ways these days. So as you can see, this is another nighttime hypnotic, is what they used to be called, again in the early 1900s out of Illinois. You can see again they were using cannabis at that time as well as alcohol in order to make people sleepy. So as I mentioned, there's different formats that we can use this plant, which is really quite nice. You can smoke it, and now smoking includes burning. That's what it typically refers to, is burning the actual tissue or the plant. You can vape, so you can vape flower. You can also vape oil. So these are two different ways to vape, which is basically not burning it, but heating it. And you can dab, and dabbing mostly refers to smoking something that's a high concentrate. You can ingest these different plant parts. So you can ingest them in the forms of an oil, a sublingual spray, a honey, tea, brownies, cookies, chocolates. You can use it as a hard candy. You can use it in gummy bear formats or gel capsules. And before we move on to the next ways you can use it, one of the reasons that we're going to find the indications for why use a plant one way versus another way is going to be for your diagnosis, right? For why you're using this plant. So we don't want to just know that there's, you know, hundreds of different ways to take it in, but it's really important to focus in on, do you need something that works very quickly? In that case, you want to use something that you inhale. Do you want to use something that maybe takes a little bit longer to take effect but lasts longer? And those are things that you're looking at in terms of edibles. Now, on the other hand, if you use topicals or pomades and creams, this is another aspect to what we can use in terms of, you know, peripheral neuropathy. You're looking at arthritic options. So those options we're looking at really, again, specifically based on what the problem is or what the etiology of the issue is. There are intravaginal suppositories available with tampon use and rectal suppositories. And we're going to get here into the last couple here. You can use them as sublingual melts, or they go under the tongue and melt away, or via G-tubes. And those two are both important options, especially with our group here today when we're talking about cancer. And when you're talking about cancer patients, you're talking about patients who are oftentimes dealing with nausea, who are dealing with inability to swallow or eat because they've got mucositis or sores in their mouth. And we want to be able to use other modalities, even through a G-tube if patients have G-tubes or NG tubes, so something going down into your stomach. And lastly, there's bath bombs as another interesting option. All right, so I wanted to give you just a couple of images here as to what we're seeing or what we're talking about when we're talking about. This is one picture of a plant with a particular purplish coloring to it. Charlotte's Web is a very common, big option or big name out there in terms of hemp-based CBD as a sublingual tincture. This is what a vape pen looks like. When we're talking about vaping oils specifically, you can see in that little line there, that's where the oil is going to be in. This is what you'd refer to as dab or shatter, a common brand for chocolate bar use. This is an interesting one because you can see it says Chronic Toast Crunch and Fruity Loops. And last one is Captain Munch there. And this is really important because what we don't want to have happen anymore, this is an older image. This is no longer available in the state of California and I believe in the state of Colorado. And the reason this is no longer available is because while it was very helpful for some people, it can pass as a children's food item. And we were finding children were having accidental uses and accidental overdoses that would land them in the emergency department. Fortunately, we had not seen any death from these types of overdose, but we don't ever want to get to that point before we make a correction and move forward. Foria, this is a specific brand or product item that is being utilized for female lubricant, vaginal lubricant, as well as orgasms. And lastly, it's even being marketed to the diaper cream. So we want to make sure we really understand and know where these are being utilized in order to get them to move forward. All right, so here we go. Most commonly when people talk to me, they always say, Dr. Yafai, you know, is this something that you can prescribe to me? Do I need to get a prescription to get this? A little bit of lightheartedness, but no, I won't prescribe medical marijuana for you because the people who make it won't fly me to the Caribbean for conferences. A little bit of a joke here, but really we are technically not allowed to prescribe cannabis products because prescriptions are a federally run program, and this is still very much federally illegal despite individual state legalities. Now, all this means is that what we can't do is write a prescription. What we can do is make recommendations for patients. So we can provide you with a recommendation to say, this is going to be beneficial for you because of X, Y, and Z diagnosis. You can consider this in order to help with pain management or nausea management or chemotherapy management. So it's important to note that one of the reasons why we don't have this as a prescription format is because the country as a whole has not yet come to adopt it as a medication. But we're seeing the trend go in that general direction. Now, the reason I say that we are seeing that trend in that general direction is because there are pharmaceutical versions of this. So there's two in particular. One is called Marinol. Marinol is a synthetic THC pill. So it is specifically designed back in the early 90s, late 1980s, for cancer treatment and for HIV patients who were having a lot of nausea and discomfort from their antiretroviral cocktails. They were providing these medications at that time. Now, in the 2020, we're in 2020 now. So in 2018, we had Epidiolex come to the market. And Epidiolex has been a really interesting new medication. First of all, biggest differences between Marinol and Epidiolex, one is THC and one is CBD. So as we described earlier, CBD is non-psychoactive, right? So it's not going to get you high. Epidiolex is a plant-based product, whereas Marinol is synthetic. That means it's made in a lab. And lastly, Epidiolex has really been approved and designed for severe forms of epilepsy. That's really where we're seeing it right now. But every 3 to 6 months, we're now seeing new research coming out about Epidiolex and CBD in general, about where it may be useful and helpful in a variety of different diagnoses. So we're here today talking about cancer treatment and where we can fit cannabis into cancer treatment. And I wanted to bring this there's about 2 really great studies out there, recent studies about oncology and cannabis in supportive care of cancer. One of the most common things that we see with the use of chemotherapy agents still today is nausea and vomiting. Nausea and vomiting can be hugely detrimental to patients. It's still not greatly controlled by pharmaceuticals, despite different advances in medicine and science in terms of pharmaceuticals. That being said, this was a great article that outlines basically that for a subsegment of patients, we do see that cannabis can alleviate chemotherapy-induced nausea and vomiting. Now, the other really important takeaway from this for me was that the inhaled forms could be better for patients who are unable to take pills. So whereas we're seeing a big push in the cannabis world and in the regular world and advertising world with using pill forms and sublingual tinctures of cannabis, perhaps that's still not the best way for our cancer patients who are having very specific chemotherapy-related nausea and vomiting. So the one thing is that we still haven't compared or have newer data for this, so we're still using very old data in order to support this, unfortunately. Along those same lines and in that same discussion article, they also discussed anorexia and loss of appetite. So in another important aspect to our oncology care is keeping weight on in order to be helpful for our patients. And one of the things that we see is that patients oftentimes lose their appetite and turn away from food and lose weight fairly rapidly, especially at the beginning, middle, and the end of chemotherapy. So what we do see, though, is that THC very specifically tends to be helpful in terms of an appetite stimulant. Now, one other really interesting part that I thought, because cancer really affects a lot of individuals in their older ages, one other interesting improvement was that very specifically in Alzheimer's patients, that they had improved behavior as well as improvement in appetite with THC use. And so this is going to be kind of another layer that we're seeing with cannabis over and over again. And you're going to see this in the later slides as well, that constantly you're seeing, well, it can be helpful on one part of the spectrum of treatment, as well as the second part, or the second end of the spectrum of treatment. And that's really why, in general, we're seeing people tend towards cannabis use, especially in oncology. So this was another article by Dr. Abrams here in California about integrating cannabis into the clinical cancer setting and arena. And this is what I'm talking about when I discuss layers. So what his discussion point was that cannabis can be useful in terms of pain management, insomnia, nausea and vomiting, anxiety and depression, as an appetite stimulant, in terms of pain management for peripheral neuropathy from chemotherapy use, and potentially as an alternative or adjunct for opiates. Now here we've got a list of about 6 to 7 different parts that we use 6 to 7 medications for in cancer. And wouldn't it be wonderful, the conclusion of this article was, wouldn't it be wonderful instead of using 6 different types of medication, couldn't we use one type of medication under the umbrella of cannabis and get those same results without kind of throwing on more medications that have more side effects with every term? And this is where I'm finding in my clinical practice the benefits of cannabis use and the benefits in terms of using different types of cannabinoids to get that ultimate benefit. So a couple of case presentations we're looking into. So again, here you see a corn remedy with cannabis and alcohol. All right, case number 1. So a patient comes into the office and has a complaint about a new diagnosis of cancer. Oftentimes we're acknowledging that patients with that initial diagnosis of cancer, you're filled with anxiety, and commonly as a result of the anxiety, also a touch of insomnia, if not a lot of insomnia. Thoughts of alternate paths to cure cancer. People come in and say, can you cure my cancer? Chemo, radiation, surgery, multiple doctor appointments, these are all very overwhelming and can kind of exacerbate that feeling of I'm scared, I'm afraid, and I don't want to be taking so many pills. Part 2 is patients usually come in after they've already gone to the dispensary and the bud tender, and they've tried to figure this out on their own, and that can be very difficult for patients and difficult for anybody. One of the first reasons why I got into cannabis as a physician was because I had a close relative who was diagnosed with breast cancer. And at the time we were told, yes, you should just start using cannabis, you should smoke pot, and why not? I hear it's helpful. And when we asked the oncologist at the time, what should we use? The oncologist shrugged their shoulders and said, I don't know, you should Google it. And that's how we got to the dispensary and the bud tender who looked all of 20, who looked like maybe they were smoking on their own off time or on time. And we found that that was really unhelpful and more anxiety provoking in this situation. So one of the things we want to do for a patient who is just starting out treatment in this very same kind of set of situations is to provide them with some options. You can use THC-based products for nighttime sleep. You can use CBD-based products for daytime anxiety. You can use ratio products to help with both of these things. In terms of cures for cancer, we don't have a perfect solution yet. We don't have a perfect answer in cannabis nor in pharmaceuticals. So what we can do is provide you with the best leg forward, meaning that we can provide you with a way to say, most oncologists nowadays are accepting that you can use cannabis with your chemotherapy agents. So why not put your best foot forward and get the best of both worlds? Whereas we can't provide you with 100% answers, we can provide you with good direction and modalities of use. So another case in which cannabis could be potentially helpful. So patients in the middle of cancer treatment, again, are filled with anxiety as a result of insomnia, thoughts of alternate paths to cure cancer, chemo, radiation, surgery, multiple doctor's appointments, still overwhelming. Now they're having nausea and vomiting in addition, as well as poor appetite and weight loss, and constipation from opiates that they're using for pain management. So one patient that I'm working with right now has pancreatic cancer and is on multiple doses of fentanyl orally, as well as a fentanyl patch. And his whole entire day is consumed by pain management. Every hour to 2 hours, he's finding himself using a pain management pill or sublingual spray in order to get his pain down. And what we've been working on together is using cannabinoids and using primarily CBD for him in order to bring the pain down and to modify his opiate use. And we've been able to do that in just a few days to get his opiate use down by anywhere from 30 to 45% in any given day. And that aspect of things provides patients to kind of go back somewhat to their normal life. So if the pain can be modified and helped on a day-to-day basis, and especially, every 3 to 4 hour basis, then perhaps we can get patients to move forward in their life and fulfill their needs on a day-to-day basis while we continue to manage the treatment aspect of their cancer. Post-cancer treatment, case number 3. So the anxiety is a little bit less pervasive. We're seeing more and more patients recover from cancer and be in the survivor phase of things. We're seeing less of the insomnia peeking through, but now there's residual pain from chemotherapy. There's peripheral neuropathy in the fingers and toes, especially with breast cancer treatments. There's residual pain and tightness in the pectoral areas and post-surgical areas, as well as post-radiation areas. So those areas tend to be a bit more fragile. Patients don't want to be dependent on their opiates, be it Ativan, benzodiazepines, or hypnosedatives and sleep medications. They want to be able to get off those medications, but oftentimes they're unable to. So using cannabis, again, in these different situations are helpful because we can wean patients off of their opiates a little bit more easily. We can provide them with a different way to offset their needs. One of the other really important things here is that we're seeing cannabinoids, THC specifically, for peripheral neuropathy as being beneficial and potentially healing, if I can use that word. But we're seeing that benefit in peripheral neuropathy with THC. And on the flip side, we're seeing benefit again from all cannabinoids in terms of healing and tissue healing. So that's another aspect that we want to see this continue to push through. We want patients to continue to have good healing and good prospects post-treatment. And lastly, we're seeing, again, an increase in chronic pain, both prior to and as a result of cannabis treatments. Patients are becoming dependent on opiates, gabapentinoids, benzodiazepines, and hypnosedatives as a result of treatment. This is not a large portion of the cancer population, but it is about 15%. One of the things that we want to do again here is to help patients ease off of those opiates and help them kind of regain their own strength and regain their own grounds as best as possible. Okay, so a little bit of lightheartedness here. Okay, docs, step away from the mildly psychoactive weed or lose your license to prescribe some highly addictive and sometimes deadly opioids. This is a little bit poking fun of what we do here. Weed, cannabis still seems very scary for a lot of patients and a lot of individuals. But when we reflect and look at it and see that the options here are opiates, which are deadly for a large portion of the population that we're seeing right now are addicted, versus something that has never killed an individual. And that's really one of the perspectives that I take to my patients, is that we can use either one, and there's no plus or minus to me as a physician. It's really what feels best for the patient, number one. And number two, how we can do this better. If both things are the same, can we potentially get you off of something that's potentially more dangerous for you in the long term? Okay, so side effects. Oftentimes people ask me about, oh, can I just take anything in terms of cannabis, and does it matter how much I use? Of course it matters. Of course, we can't just recommend patients using anything because there will be side effects and things, everything, even water comes at a cost. This is, again, on this slide, you'll see another one of my favorites. For nerve improvement, for nervine elixir improvement, again, you're seeing cannabis. This is back in the, again, the early 1900s in Ohio as a usage, and it's what we're seeing again now. So when you're using THC, the most important part is that we cannot use THC during driving. So I don't recommend patients actively smoke THC products and drive. That would not be a bright idea on any level. But more importantly, for my cancer patients who typically aren't driving, one of the things we do want to pay attention to are drops in blood pressure, lightheadedness, changes in heart rate, and sleepiness. Those are the big ones because, as we mentioned earlier, sometimes when you're not eating and drinking well, or you're already nauseated, your blood pressure is already at risk for dropping, you're already getting a little bit lightheaded. So it's something we want to do with caution and with an eye forward looking at that. Where the biggest side effect by far and away for all of my patients is dry mouth and dry eyes. Dry mouth is something that is very common. Most people don't really notice it. They just think that they're a little bit dehydrated. Dry eyes is what's causing some of that redness. There was a really nice study in 2012 done by Dr. Donald Tashkin at UCLA showing that there's no risk for lung cancer. We're not seeing any lung cancer, but we are seeing with smoking very specifically, you can see an increased rate of coughing. It hasn't been associated necessarily to COPD, but that is something we want to be mindful of. Overdose, there is a risk for overdose with taking too much. The difference though between this and something like an opiate is that we're not seeing a lethality, meaning you don't die of cannabis overdose. You can feel really terrible. You can see changes in your heartbeat and your blood pressure. You very well may end up in the emergency department, but you will not die. Addiction, just like any other medication, it's something we always have to be mindful of, that addiction is possible. The rates of addiction are very low. They're lower than opiates by about 50%, if not more. So it's, again, it's a combination of what our anticipation is as well as what we're using this for. We don't want to prescribe or recommend THC use to a 15 to 20-year-old just for fun, but it is important to be able to use this in these settings. Euphoria. Now, I put a question mark next to euphoria very specifically because euphoria, up until very recently, has been an unwanted side effect for physicians. Now, when we talk about cancer, I oftentimes ask my patients, we don't talk about your happiness level in the medical offices enough, in my opinion. And I think that we need to talk about happiness because we know that mental health, happiness, anxiety, depression are all interrelated to how we do physically. They're all interrelated to how we feel on a day-to-day basis and how we want to pursue our lives. Nobody wants to be depressed. And if we know that opiates can cause some level of depression with chronic use, and we know that cannabis, and again, specifically THC, can cause happiness with chronic use, I think the latter is probably a better option. And lastly, of course, recreational misuse in teens. So we want to be conscientious of that as well. So there's a couple strict contraindications. So for transplant patients, I'm talking about liver transplant, heart transplant, lung transplants, we want to avoid using CBD because that can cause problems with medication interactions. That being said, also CBD with specific seizure medications we have to be cautious with, and we have to be mindful of the dosage. Patients with pulmonary problems, we want to avoid using inhalation pathways. Patients with previous allergic reactions, of course, we want to avoid completely. Now, specifically speaking with THC, narcotics, benzodiazepines, and other sedatives, we want to be conscientious about combining it with THC. It's not strictly contraindicated, but you should have a doctor on board giving you advice on how to use that. Again, with antidepressants and anti-anxiety medications, that can also make you too sleepy. Schizophrenia and bipolar disorder, I would leave that up to your doctor or psychiatrist to have to weigh in on before using these medications. Okay, and the last one, COVID-19 and how does it relate? Does it relate? Number one, if you're smoking cannabis and you are diagnosed with being COVID positive, I do recommend you avoid smoking it for the time being. We are seeing conflicting data in terms of it being beneficial for COVID-19 treatment. I do suggest that you consider alternatives to smoking at this time and using oils and edibles. I also recommend people avoid sharing inhaled products such as vape pens, bongs, etc., because that is a means for COVID-19 to be transmitted. But we do want to continue to take a look and see if this can be beneficial. Some studies are looking at CBD as being beneficial as an autoimmune or inflammatory reaction, which is part of the problem with COVID-19. And so it's another means to take a look at how this can be helpful. But again, this is something that I would suggest discussing with your doctor if and when you should get diagnosed with COVID-19. Okay, well, I'm going to get to questions. I see there's a question up there in just a moment. Membership benefits for SCC. Oh, I just wanted to take just a minute to talk about this. Society of Cannabis Clinicians is an educational group for clinicians, physicians, medical practitioners, in order to provide them all with good educational resources, lectures, and information. We offer a number of different educational videos, discussions, journal clubs, and quarterly meetings with specialists and experts across the entire world. So if this is ever something that you're interested in looking into, I do recommend taking a look. It's cannabisclinicians.org, and they're a wonderful group and organization. Okay, I'm gonna take the last, I think, 10 minutes here I've got and say thank you very quickly to BACC. If you want to get in touch with me after this, I am taking telephone consultations only, and those are my numbers and information. You can reach out to me, and I believe you'll have that available as well. I'm going to take a look at all the questions and answers right now, and we'll take a look if that's okay. Colleen, I don't know if you have any other suggestions.
Yeah, thank you so much, Dr. Yafai. I'm Erica Bell here on staff at BACC, and I'm going to help with the Q&A for you. So
perfect.
I will tell you the questions. You can just answer. So the first question we have is that chemo obviously can negatively impact the liver, and what impact, if any, does cannabis have on the liver?
Good question. So cannabis is metabolized or broken down by the liver. That's how we process that medication and how it goes through our system. In general, we're not seeing a negative impact of cannabis on the liver, similar to other medications. So until a certain point, most medications are processed normally. And then when you go over a certain limit or a tipping point for your liver, then it kind of overwhelms the system. And what happens when you take too much, for example, is that it makes the other medications you're also taking have a hard time getting metabolized. So in effect, it makes it backs up the dam and overflows your lake. So if the lake has other medications in it, you're seeing an uprising in all of those medication levels. So what's important to note there is that if you're on multiple medications, including cannabinoids, that you probably want to get your liver function tests checked, every 3 to 6 months, depending on what you're taking and the dosages and when you're taking them. Now, the one other thing that we are not seeing is damage in terms of fibrosis. So we have not seen any fibrosis caused by cannabis use that can be caused by other medications.
Thank you. Then we have some questions about inhaled versus edibles. Do the edibles have a stronger effect than smoking? And is there any research, I think you mentioned a little bit, about the effect of inhaled THC or CBD compared to smoking cigarettes or any other dangers?
Great question. So in general, inhaled THC or CBD, the general suggestion at this point I would give you as a medical doctor is we want to avoid smoking when we can. And smoking is really what I consider when you get a joint and light it up with fire. That's smoking. On the other hand, we're seeing better outcomes when you vape flower. So you take a vape pen that heats the element, but it doesn't burn the flower. So you're not getting that same type of burning flame. And that is better for your lungs overall, just from a general kind of medical perspective. Now, when we're seeing data specifically about smoking, and most of that's going to be about smoking a joint, for example, what we're not seeing is an increase in pulmonary cancers, meaning lung cancers. We are seeing a questionable rate, the same, I don't have a clear number on that, but the same is projected as if you were going to light anything up around your mouth. So you want to avoid that with oral cancers, right? Something that's being burned around your mouth. That being said, the difference between smoking versus edibles really has to do with what your goal is, what the problem is, and why you're using it. So for example, if the problem is nausea, I recommend vaping as opposed to taking an edible because of the time it takes for an edible to kick in. So an edible is going to take anywhere from 45 minutes, usually at its earliest, to 2 hours to take effect. Whereas when you smoke or vape a product, you are going to get effects within anywhere from 2 to 5 minutes. And for nausea, that's really a big difference, right? When you're nauseous and don't feel well, you need something to take effect now.
Yeah, that's a huge difference. Thank you for that advice. Is there any evidence or research on treating depression with cannabis as compared to standard antidepressants?
So the data is still a little bit unclear about using cannabis versus antidepressants. There's a lot of general population suggestion that says that people who attest to, I've used cannabis for years because of my personal antidepressant, as an antidepressant, not me, for example, but people across the world are saying that, whereas the data for it is still not kind of up to par. If you're using an antidepressant and getting good success with it, then I suggest not changing. If you're using an antidepressant and not getting good success with it, that's when it's time to make a change or move or try something new. Cannabis can be very fickle and it's very individual. Some people do very well with it and some people don't. So you have to be really cautious about it in that sense.
Okay. Are there any contraindications with using CBD for insomnia and anxiety for people who have had both cancer and also heart disease?
No, there's no contraindication. You just have to we start with the mantra of start low and go slow, or talk to your clinician about it. And if you need to find a local cannabis clinician, you can go to that cannabisclinician.org website and find somebody local to you who could help you, advise you. But in general, it's not contraindicated. You just have to be mindful about the dosing and your other medications that you're using.
Okay, thank you. We have a specific question about when you said vaping a flower, do you mean purchasing a specific vape device that can burn flower or any vape that uses oil or wax?
So that's where I'm differentiating. So oil and wax are going to be in a separate category and flower is going to be in a different category. So you can vape oil and flower, or oil and wax, or you can vape flower. And the mechanisms, the tools to do that are different. You can use the Volcano, a PAX vape pen. They're very specifically designed to vape flower, whereas the vaping oil and dabbing oil is very different as well. And the concentrations of THC in these two different items are very different. So when you vape flower, you're getting anywhere from 10 to 30% THC. When you're vaping oils, you're getting, at the very least about 50% to 90% THC. So that's a big divide in dosage and concentration.
Okay. Is there any risk in using cannabis with estrogen positive breast cancer? For instance, is cannabis in any way estrogenic?
Good question. No, and in fact, it's one of the types of cancer that seem to be most beneficial in terms of using cannabis. We're starting to see research very specifically about breast cancer and different types of hormone receptor positive and how they interact with cannabis, specifically almost as a treatment for the cancer itself. And I don't use that word very often because we're still on the brink of it. We don't quite know 100% of how much the dose has to be. Is it weight-based? Is it specific to THC or CBD or the minor cannabinoids? But what we are seeing is it's beneficial in terms of treatment aspect.
Okay. Does using a cream help with the peripheral neuropathy caused by chemotherapy?
Good question. So the verdict is still out. Some patients have responded very well to using a cream. Some patients don't. I think it's a very easy way, non-invasive way to give it a try. So I always recommend that as a first stepping stone. I would start with either CBD or a THC mixture and try either one. And if you see results, you'll see them fairly quickly. The creams take about anywhere from 30 to 40 minutes to take effect. You do need to reapply it. It's not just a one-time fix, but you do see benefits from applying it, 2 to 3 times a day.
And have you, in your experience, do people develop a tolerance to CBD for things like anxiety or even insomnia?
Somewhat. So in general, we start with the mantra of start low and go slow. And the reason for that is that people do need to adapt a bit to cannabis. So you can't start, for example, at 5 milligrams of THC for most people because it's an overwhelming amount. But that being said, you may end up at 5 milligrams of THC after, 1 or 2 months of usage. Now, that gets me to the tolerance part. So we think of tolerance usually with opiates because you build a tolerance to opiates and you need more and more. The flip side with cannabis is that people tend to build up to their maximum tolerance of cannabis, and then they typically can't push up above that. Some people can. Cancer patients are known to kind of need more than the average individual because they have a lot more dysregularity and imbalance in their whole body and their whole system. And so we probably use a little bit more than the average individual in our cancer patients. But that being said, usually you hit kind of your sweet spot in terms of cannabis and you stay there for a while.
Okay, interesting. Well, that was the last question that we had in the Q&A box. If anyone has any last minute questions, now's your chance. We have a couple of minutes left. But in the meantime, I'd like to thank you so much, Dr. Yafai, for sharing your expertise on this topic that is of relevance to so many of our clients at BACC. So thank you for being here today, sharing your knowledge, and thank you all for joining us.
Thank you for having me. I think this is a great event, and I hope that we continue to have these types of discussions. And next year, we'll have the discussion about how to be able to use this very specific types in a little bit more detail. I know everybody comes from far and wide backgrounds of cannabis, and it's always a difficult first time discussion to have.
Well, it looks like we did get one last minute question in, so this will be the last one. How can you determine the quality of all of the different CBD products? My understanding is that they're not regulated, so.
Yeah, great question. So CBD in particular, so we're talking typically about hemp-based CBD products, are now legal across the entire 50 United States since about 2 years ago. And since that point in time, the FDA has not started regulating this product. So you can find things that falsely advertise the amounts that's in the product. And that's a big problem because we're seeing a lot of this being sold over the internet, in CBD pop-up stores, in hemp stores. For a while we were seeing it as coffee additives at your local coffee shop, and you really had no idea what you were getting. One of the best ways I can suggest is, one, go through a reputable brand that's been around for a while. You can ask friends about that. You can go online and you can find reference to those. The other really important way is to ask them for a certificate of analysis. So I'm going to repeat that word because it's really important. Certificate of analysis. It's also abbreviated to COA. And a COA gives you typically a licensed laboratory, independent testing of what's actually in the product. So you're going to look to make sure that On that certificate of analysis, you see that the product, if it's advertised for 30 milligrams per ml, that it verifies that it's got 30 milligrams per ml. Oftentimes those numbers are off by maybe 1 or 2. Sometimes they've got 28 milligrams per milliliter. Sometimes they've only got 32 milligrams per milliliter. So that's sometimes off by a little bit, but that's really what you want to take a look at to make sure you're getting what's advertised.
Okay. Well,
and sorry, one last thing. And that'll be on their websites. So you'll be able to see that if you click up on their websites usually, or they have a QR code on their product line that you should be able to take a picture of and have that lead you to their certificate of analysis. So the laboratory testing.
Got it. Perfect. Well, thank you once again.